Doctors of Reddit, what do patients do that annoy you? Non-compliant, so you're not feeling any better after the antibiotics. I didn't take them. Med student, but usually something along the lines of, are you smoker? Nope. Have you ever smoked? Yes. How long were you smoking for? -2 packs a day for 50 years. When did you give up? 3 days ago. My partner is a doctor. She had two answers. First, the doorknob comment. Come for a 15-minute appointment. Spend 14 minutes talking about a mild cough. Then as she goes to leave the room, patient suddenly remembers, oh, yeah, and my penis is green and smells strange. Second, having to write medical certificate/letter for employers that require them if someone takes a day off because they're sick. Waste of everyone's time. Patient stated he has a cold. Examined and determined that patient does indeed have a cold. Thanks for wasting my time.
N.
When patients tell me I've got a really high pain threshold during the history and then act like they are being axe murdered when I take blood or put in fourth line. When they come in with non-evidence based, unproven and sometimes dangerous recommendations from their naturopath's egg. Broccoli juice cures cancer. Or they come in saying my churro said I had a stomach parasite, but luckily he fixed that. And that prostate cancer you said I had last year seems to be gone now with my homeopathic spider venom. I'm just here for a checkup because I can't ejaculate anymore and there is blood in my urine. According to my nurse girlfriend, when they bring their family member who has some medical training and that family member orders me around. A nurse here. This situation goes one of two ways. Option 1. The family member that's in the medical field recognizes good care and is appreciative. They can suggest things if they feel it's necessary, but they are extremely supportive and grateful for your attention. Option 2. The family member is a complete tech freak that tries to dictate care from beginning to end. From, why are you drawing blood that way, to I'd never give that medication. You're idiots. This person will never ever be satisfied. And they will freaking ruin your life, even though their family member is being well cared for. It is not their fault, but where I came from we have to see 40. 60 patients in an afternoon. Time is of the essence and we have nearly 15 minutes to interview, figure out what they have, and tell them what can be done. Because of the time frame, during the interview we need objective answers, something patients avoid like hell. We ask when the pain started and they say, well, I was at Mary's wedding when it started. Thinking, Hoss Mary, when was it? 28th day. Thinking of which month? I have several other patients and don't want to be rude with this one, but I need answers. When they come up with these miraculous ways to lose weight fast or ways to keep looking young. Come to me and ask me what they could potentially have and then interrupt me because their Google PhD knows better. Animal doctor here. I hate when clients bring in their pets for a sick exam and decline all diagnostics and treatments. It's one thing if they're financially in a rough spot, I try to help them out as much as I can. But it's another when they say things like I just don't believe in medicine or I think I can fix this with coconut oil/turmeric/essential oil/crystals and I don't trust any of your advice. I feel like I've done nothing to help their little friend and I worry about their pet all day. Bonus anger when they want to pay for a toenail trim for $20 and the medicine thief declined. It's cheaper than that. I've even gotten notes when I try to give them a free trim so that I could send home meds. My mom worked at a vet clinic 4 years deep in Alaska. People would bring in dogs, mostly sled dogs on the brink of death or all torn up from accident, and absolutely refuse any medical advice. It made no sense. The animals were in significant pain and could clearly be treated, yet the owners refused. It's like they were just curious what the symptoms were, not how to actually remove the pain. The most fricked up thing. The vet worked 15% pro bono, so a large portion of these non-caring fricks could have gotten free treatment. Instead, they passed. Not a doctor for the sake this post, but pharmacist chiming in. Patient, I have a 2-year-old with a runny nose, and I found this homeopathic remedy that doesn't actually have any medicine in it. Is this a good choice? Me, well, there's no evidence to suggest that this product is effective, but this Claritin/Zyrtec is not only cheaper, it has real medicine in it that has been clinically proven to help manage allergy type symptoms including runny nose, and is labeled for use in a child this young. Patient, no thanks, I'll just give this other crap after wasting 10 minutes of your valuable time against your professional advice. As a doctor, I really have to add in that a lot of these comments bother me. The last thing a big portion of these patients need is another reason to be scared of going to the doctor, personal judgment from the doctor. If the patient came in with what you consider a low-level reason, take the time to educate. That is at least half the reason any patient is there, and they appreciate it. Ask yourselves if you enjoy going for medical/dental visits yourself. I don't. It can be a vaguely embarrassing/invasive/humbling experience. Though, I do appreciate the value of being educated again, of what it's like to be a patient. While I don't see it often, there is one thing that annoys me about patients, though I won't express it to them. Anyone who defends cigarette use as something more natural/relatively innocuous. I had the aunt of a pregnant teenage patient rhetorically ask me if quitting smoking would cause a shock for the baby and therefore be harmful for the pregnancy. It was clear from the tone that she thought the girl should continue to smoke. Another wanted only natural medication/vitamins during the pregnancy, no vaccines. Fully natural childbirth with no cord cutting, all of which I'm fine with for the record, but continued to smoke 1/2 ppd during the pregnancy. To all smoking pregnant/preconceptual patients I say, for the grand majority of pregnancies, up to the point the child is born, you quitting smoking is more important than anything I can do as a doctor, and I will gladly help you in any way I can towards that goal. N. Not a real doctor, but a dentist here. There are a few things that irk me, but I do realize that people really do not want to come to the dentist, so I try my best to ignore most of it. So the only thing I'll say without trying to toot my dentist horn here is that, believe it or not, a lot of the things we do in dentistry on a day-to-day basis are actually pretty difficult technically. The fact that we do it so often that it becomes routine does not change that. I realize that patients have no idea what I'm doing in their mouth for the most part, but believe me when I say that mistakes within fractions of a millimeter can mean the difference between an amazing result and catastrophic failure. As such, when patients have either a bad attitude or are not interested in trying to help me, it adds a huge degree of difficulty to something that is already hard enough. People who don't open wide on purpose even after being asked, or keep trying to sit up and want to rinse constantly, or ones that try to grab my hand when I'm giving an injection or drilling. I'm not asking you to do or not do certain things solely for my own good. It's actually for your own good, so that I can achieve a great result for you and your dental work. And also so that I don't accidentally bury my drill into the side of your tongue or the floor of your mouth while you are squirming around. TL. Doctor, be kind to your dentist and try to make their job easier when you are in the chair. Even though you are a paying customer, the easier you can make it for them, the better quality dental work you will have in your mouth. Their main concern, if they are a good dentist and yours, should be achieving a quality, long-lasting result for you. I'd say the general belief many patients have nowadays, that pain is never okay, that being sick and feeling like shoot while your body heals is unacceptable. You broke your ankle, I can do lots of things to help you heal and be in less pain, but it's going to hurt. Being pain-free is impossible. You have the flu, you're going to feel like complete as for 5 to 7 days, feverish, itchy, weak, coughing. Frankly, unless you're seriously ill, you shouldn't be contaminating your community in my waiting room. Go to bed, take Tylenol or ibuprofen, fluids, and wait. The eternal paradox of demanding all of the physician's time for themselves while expecting him to tend to others quickly. Did you waste 15 minutes of your consult shuffling papers or going on about unrelated stuff? Take a look at the next person going in as you walk out of the consultory. That's also his/her time you were wasting. Belittling their GPS/family doctors. I'm not a GP, but they don't just deal with colds and gastro. If the GP misses your DVT, you could die. If the GP misses your bowel cancer, you could die. If the GP doesn't treat you for a community-acquired pneumonia, you could die. If the GP doesn't realize that your headache is actually meningitis, you could die or be left with brain damage. And what is there to belittle? GPs in Australia can make at least $35 for 2 minutes of work. That's all it takes to sort out a sick note or a flu shot. Not a doctor, but when I'm doing history intake, when the patient says it should be in the chart for basic screening questions like, do you have a family history of cancer? Some of my absolute favorite things to hear as a GP. No, you see, I know my body, before diagnosing themselves with the most ridiculously far-fetched affliction they managed to Google. I have a high pain threshold, but before fainting from a hypodermic needle prick, I never ever run a fever, or the opposite. No really. 36. 5 dead point C is a very high fever for me. You don't understand. I need this cold to go away as quick as possible, and that's why I really do need antibiotics. Oh, I'm sorry. That's alright then. My bad. Telephone call at 2:30 in the morning. I can't sleep. Well, neither can I now. And yes, this actually happens. My personal favorite are patients with lower back pain, demanding investigations for their kidney pain. Must be awesome to be able to diagnose yourself. What do you even need me for? And just for shoots and giggles, here's my real absolute favorite thing a patient has ever told me. My date of birth. How should I know? I never went to school. Edited for clarity. The biggest thing for me is not being able to provide a useful medical history. Even if you don't know anything about medicine, you should know whether or not you have diabetes/high blood pressure/lupus. Same for medications. Just write down a list and bring it with you. It's amazing how many people can't tell you how long they've had X symptoms, if they've ever had them before, etc. And no, I can't skip the questions and just look in the computer, because the electronic records are often incomplete or out of date. I know we ask a ton of questions, but I promise they're important and it's really hard to help you if you can't answer any of them. I stopped taking my medication 3 months ago because my bingo buddy said it doesn't work. No, I didn't tell you, because I thought you'd be upset. I want what's best for you. If you're not okay with the treatment, we can talk about it. Also, when said friend comes in and says they only use their daily mess once a week because it didn't work. Gee, I wonder why it wasn't life-changing. Not a doctor, but I work as a technician for a dentist. Whenever a patient says I'm planning to go to insert a place ridiculously far and permanent trip out of the country in 2 days, please get this done by then. When that happens, you're basically asking for a shoot job. There's a good chance whatever work you're getting won't fit properly or may crack/break in a few months. Besides the obvious rush mentality that gives the result a risky conclusion, it's also because you give very little option to the dentist to do try-in appointments. The try-in phase is very important and a good investment to ensure that your restoration will turn out good. To compare, what you're basically doing when you ask for something in 2 days is you're completely skipping the test drive and just buying the car off of what you know from specs and then expecting to be satisfied with it. Be kind and give your dentists and technicians a good minimum 4 to 5 working days for low unit jobs, i.e. single crown, denture flipper, and 8 to 12 working days for high unit jobs, full mouth restorations, multi-unit crowns and bridges, implant work for each part of the phase. I'm a dentist, and we know most patients are pretty high anxiety and everybody deals with that in their own ways. Sometimes it's talking a lot, sometimes it's wincing even though nothing hurts, sometimes it's even being mean to me or my staff. We get it, and that is why we spend time before any procedures explaining things and talking about anything you want. But what really annoys me is once we get going, I just need you to sit still and keep your mouth wide open. I'm performing microsurgery on your tooth with a very sharp drill that spins at 300,000 RPM, and I need to make cuts to tolerances of 1/10 of a millimeter in dark confined spaces in the back of your mouth. I'm sorry you don't like the feeling of your own saliva pooling in your mouth, but I just need you to suck it up for 30 seconds so I can do a good job and we won't have to redo this in 6 months. Wife is a radiographer. She takes the x-ray pictures. It's all the people who just don't freaking list lie on your side, does not mean on your front. Hold still means exactly that. By having to redo x-rays, people are getting extra doses of radiation. I cannot believe how stupid these people are. From the stories she tells. Patients who don't use their screening opportunities. I'm in the UK, so it's all free, but so many people don't get their cervical smears or bowel cancer screening, mammograms, routine ST and HIV checks, not just when you think you might have caught one. It's such a small part of your time and has the potential to save your life. When the question asks a specific group, example, doctor/engineer, and you get a million not a doctor-engineer people chiming in. I'm a doc. The worst is the patient that is allergic to everything except the medicine that they want, which is diluted most of the time. Not showing up on time. My schedule is usually tight, and if some wheel throws it off, it doesn't just mess up my day, they are impinging on someone else's time. I just find it incredibly rude. I understand should happen sometimes, and people can't help it, but some people are just chronically late for no real reason. When I ask a question and they don't want to answer, I'm not here to get some gossip on you. I honestly don't care on a personal level. If you do eat dog food, put stuff up your butt, or like the smell of glue, but all that stuff that sounds either invasive or irrelevant to you can potentially be medically relevant. Case in point, something as out there as whether or not you eat grapefruit is medically important in certain situations. If you take certain drugs, it can negate the effect. I feel so much better about staying home for anything less than 8/10 pain or an infection that lasts longer than a week. Doctors, am I doing the right thing by staying home with gastro as well? Doctor here. Yes, absolutely. Rest and electrolyte replacement fluids are the way to go. But if you're unable to keep down fluids at all, or if it's lasted longer than a few days without getting better, it's totally reasonable to see your GP. They can give you anti-nausea meds to help get you drinking, and can send off your stool to make sure it's not something nasty. Say that they have a high pain threshold. No, you freaking don't. You get to make this claim if you're giving birth while browsing Reddit, not if you scream and cry while getting your blood pressure tag. As an emergency medicine doctor, leaving against medical advice when they have something serious. I had a patient with a very large pneumothorax collapsed lung. He insisted that he knew his body and had to leave so he could sell his car. Another patient had a STEMI, the more serious type of heart attacks, and left against medical advice from the ambulance. Even had the cardiologist talk to him on the phone, essentially saying, if you don't come to the hospital you'll almost certainly die, and still insists on not coming in. Heroin overdose patients that act like jerks. Happens so oft, patient will be passed out, not breathing, vomits, has pneumonia in multiple lung lobes, on death's doorstep. But once you resuscitate them, all you get is a middle finger, literally get spit on, and sometimes they'll swing at you, screaming. Not all of them are this bad, but so many of them are. Non-emergent complaints. Our emergency department gets full to the brim with patients. Wait times are long. Resources are low. Some patients clog up that system with non-emergent complaints that should be dealt with in a clinic setting, not the emergency department. Medication refills, or their specialist appointment is too far away, and they want to be seen by that specialist that day, or back pain thief had for 50 years that isn't any different today than usual. Overall it's not bad though. A patient who's even a little appreciative goes a long way in making it feel worthwhile. Being able to actually reassure someone who was just scared over something small, or getting to make a positive impact in someone's life when they have something big makes it feel worthwhile between a lot of the jerks we encounter. Honestly, showing up late to an appointment, I feel obligated to see them, and then my other patients end up waiting. Even if it's just 5 minutes, it adds up over patients, and it's tough to cut a visit short when you only have 20 minutes allotted in the first place. A patient can come to me with the most bizarre or trite complaint and it won't bother me because I'm there to help them out. But I hate keeping my patients waiting as much as they hate having to wait. My mother has worked as a biller for a doctor's office gastroenterologist for years. Some of the ones she comes home complaining about include, but not limited to, people telling her about their symptoms. She's not a doctor. Please save this for him calling to complain about how much an office visit costs. Yes, even if it is $20, she does not control this. There is not anything she can do about it. Bringing in stool samples to show her yes, it really happens. Coming with a complaint and giving really vague answers to all questions. For example, me, when did it start? Patient, oh it's been a while now. Me, how long is a while? A day, a week, a month. Coming in with extremely complicated / tight clothing. Please assume that, if you are coming in for an e-complaint, that you are going to have to take off your trousers, shoes, and socks. Please don't wear any high lace-up boots. Wear slip-ons. Although each of these things only takes 30 seconds extra, if each patient has a few of these macro delays, that means that at the end of the day I will be running an hour late. This helps nobody. New patient, I need refills on my medications. Me, I haven't prescribed you anything before. What were you taking? New patient, Vicodin and Xanax. Me. What's really frustrating in this thread is that I understand why some of those things would annoy doctors, but it's also turning people away. The best would be to have, like in the UK, a helpline to explain what's going on that would help you decide what to do. That way you don't uselessly clog services while still talking to a professional. When they blame me or their other doctors when we cannot fix their health issue, especially with older patients. Except for organ transplants, we are not auto mechanics who can just switch out old parts or faulty circuitry for new ones. Nature is the one trying to end your life. We are trying to prolong it and make it easier to bear. It's just that in some cases, try as we might, we simply cannot always do that. And for God's sake take your medicine. Or don't, but be prepared to face consequences for not doing so. Sure, the pills make you drowsy. The pills are also preventing your third, and perhaps fatal, stroke. It'll write you the prescription, monitor your response to the medication, etc. But being self-responsible and following through is up to you. I love my job, but there is a distinct faction of patients who don't want to take responsibility for their own health, and look at doctors like we are the landlords of their bodies and responsible for its upkeep. In reality, we are more like contractors brought in to salvage what we can after a natural disaster. Not a doctor, and not a patient per se, but I had a woman call 911 for a body who was supposedly murdered underneath a railroad bridge during a massive music festival. When we got there, it ended being a log with a jacket thrown over it, and a very drunk woman sobbing over said log. My mother is a nurse. She always complains about when you show the pain scale and they say 11/10. That and ecta 2s. Not a doctor, but I work in a pharmacy. The number one thing is people who say fill all my prescriptions. Especially those with a ton of medications. I know you're supposed to be taking them all, but at least have the name of the medicine / prescription number. I can't just fill 20 different prescriptions and not verify with you if you're supposed to continue taking them or not. Others too calling their doctor for a refill / saying it's our job to give them emergency supply until their doctor approves. It's not really, we just don't want you to die / end up in hospital. Also with refills on most maintenance, doctors will write for a year or 6 months and want to see the patient annually or biannually. I've had patients complain and ask for my manager when their doctor denies a refill. Seriously, there's nothing we can do if your doctor says no. 3 doesn't bring their insurance card but complains about a copay. Just because we're contracted with your insurance doesn't mean we have your information. Also calling them takes a long time.